Hi, this is Dr. Jeff Nelson, your Utah Wellness Doctor with Freedom Healthcare. Today I want to talk about thyroid. Very common thing that we see here in the clinic, well, in any clinic anywhere in the world. Thyroid is a very common complaint. So let's talk about what low thyroid feels like. We'll also touch on high thyroid. This is the most common presentation, and so we'll go a little more in depth with this. So the symptoms of low thyroid: cold, especially cold hands and feet. You get a lot of women who come in and say, yeah, my husband says that my feet are freezing. So cold hands and feet, body temperature regulation problem. Fatigue, dragging, tired, depression, or it could just be dysthymia, which is basically I'm not as happy as I used to be. Dry skin, very common. Hair loss in women. This is one of the most common causes for hair loss in women. They'll come in and say, every time I shower, I know I'm going bald. Unfortunately, it's not the cause for hair loss in men, otherwise this wouldn't be here. Constipation is a symptom of low thyroid, and weight gain despite all you can do. You're trying to fix your diet and everything, yet your body just seems to keep wanting to put on weight. So let's talk about the symptoms of high thyroid real quick. Instead of cold all the time, people complain of being uncomfortably warm. Instead of depressed, there's often an anxious or stressed feeling that goes along with high thyroid. Instead of dry skin, there's moist skin. You can get palpitations. It's almost like a caffeine overload. Heart fluttering, anxious, jittery, on edge. You can get mild daily headaches and loose stool instead of constipation. And oftentimes you can lose weight too quick and too easily instead of weight gain. And that can be bad in its own sense. Okay, the most common cause of high thyroid, it's usually an autoimmune disease, something called Hashimoto's or Graves' disease. And oftentimes these things will run in families. And so this is an autoimmune problem where your immune system turns out to start to attack your own thyroid and you overproduce thyroid hormone. Now, most of these people will eventually burn out and end up here. But the treatment for that is a whole nother discussion for another time. So let's talk about low thyroid because this is very common. As a younger physician, I would have, let me tell you a normal situation, a situation that I had multiple times as a younger physician before understanding a lot of the literature and the research on thyroid. I would have a woman come in her mid-30s, oftentimes, and she'd complain of hair loss. Every time she combs her hair, brushes her hair, takes a shower, it's just falling out. She's cold all the time, she's tired, she's just not happy like she used to be. Gaining weight, yet she's doing everything she can for diet and exercise, but she has zero motivation for life. Constipation, dry skin. And I'd be like, oh, I know what this is. This is thyroid. I'd check her labs. I'd check a TSH and a free T4, and that's it, because that's what we're taught to check, and they would be normal. And so I'd say to her, well, your thyroid's normal, so I don't know, maybe wear a sweater, exercise more, try to get good sleep. Here's your Prozac for your depression. Use some lotion for your dry skin. I don't know why you're losing hair, so go to the dermatologist and talk to him about that. Use some Metamucil and exercise more and eat less. And I would completely miss it. She's sitting there telling me in every sense of everything that she's low on thyroid, yet I told her it wasn't her thyroid. And after learning more and being around a lot longer as a physician, you learn to listen to the patient, okay? Now, there is a range of normal on thyroid, and a lot of these people are hanging down at the low end, yet their body wants to be at the high end of normal. So you gotta listen to the patient and treat the patient. The lab is a guide, but the patient is the real person sitting in front of you. So when you treat someone with thyroid, all these symptoms get better. And then you let them go, you find the dose that the patient feels best on, and you know what? Almost always they end up right up there at the top end of normal instead of at the bottom. So let's talk about the treatment for thyroid. Thyroid hormone, they make synthetic thyroid hormone and there's bioidentical thyroid hormone. What's the difference? The bioidentical thyroid hormone has T1, T2, T3, T4 in the normal natural human ratios. Those are the full spectrum of thyroid hormones. T3 being the most bioactive, potent hormone there. Synthetic thyroid is just T4. And a lot of people have a problem converting T4 into T3. And so when they're on synthetic hormone, they get them treated, the labs look great, they're on synthetic hormone, but they still have a lot of these symptoms. And then if you check a broader spectrum of labs and look at their T3 level, it's really low. So they have a lot of the less potent thyroid hormone because they're taking it in a synthetic form, but they have a very low level of the potent one. And so almost always, if I switch a patient from synthetic thyroid to a full spectrum natural bioidentical thyroid, bioidentical meaning the same thyroid that your body makes in and of itself. So switch them from synthetic to the full spectrum natural, they almost always feel better. So if you have any questions, if you think you're suffering from some of these symptoms, come on in, we'll talk to you. Here at Freedom Healthcare, we do our best to not only check labs, but actually listen to the patient.